HIV, or human immunodeficiency virus, attacks the immune system, specifically CD4 cells, also known as T cells, which help the immune system fight off infections. If left untreated, HIV can lead to the disease AIDS or acquired immunodeficiency syndrome. Let's discuss it. Number 1. Initial infection. When a person contracts HIV, or human immunodeficiency virus, the virus targets and infects CD4 cells, which are crucial for the immune system's ability to fight off infections. Initially, many people may experience flu-like symptoms shortly after infection, known as acute HIV infection or primary HIV infection. These symptoms can include fever, swollen lymph nodes, sore throat, rash, muscle and joint aches, and headache. However, not everyone will experience these symptoms, and some may mistake them for a mild illness or flu. Number 2. Chronic HIV infection. If left untreated, HIV continues to replicate and gradually weaken the immune system over time. During this phase, the virus continues to attack and destroy CD4 cells. As the immune system becomes compromised, the body becomes more susceptible to infections and certain cancers that a healthy immune system would normally fend off easily. Despite the lack of noticeable symptoms during this phase, the virus is actively damaging the immune system. Number 3. Progression to AIDS, or acquired immunodeficiency syndrome. AIDS is the final stage of HIV infection, characterized by severely compromised immune function. AIDS is diagnosed when the number of CD4 cells drops below 200 cells per cubic millimeter, with the normal range being 500 to 1,600 cells per cubic millimeter, or if the person develops one or more opportunistic infections or AIDS-defining cancers, regardless of CD4 count. Opportunistic infections are infections that take advantage of a weakened immune system and can include conditions like tuberculosis, pneumonia, fungal infections such as oral thrush, and certain types of cancers like Kaposi's sarcoma. Number 4. Symptoms of AIDS. When someone progresses to AIDS, they may experience a range of chronic symptoms, including persistent or recurrent fevers, profound fatigue, rapid weight loss, night sweats, swollen lymph nodes, and diarrhea that lasts for more than a week. There can also be a persistent cough and shortness of breath, skin rashes or lesions, and neurological symptoms such as confusion, memory loss, and other neurological disorders. These symptoms are often severe and can significantly impact a person's quality of life. Without treatment, the average survival time after developing AIDS is typically around 3 years, although this can vary depending on various factors such as access to healthcare and the presence of other medical conditions. Number 5. Treatment and management. Effective treatment for HIV involves taking a combination of antiretroviral medications, known as antiretroviral therapy, or ART. ART works by suppressing the replication of HIV in the body, reducing the viral load to undetectable levels in the blood, and allowing the immune system to recover and rebuild CD4 cell counts. When taken consistently and correctly, ART can help people with HIV live long and healthy lives, reducing the risk of developing AIDS and preventing transmission of the virus to others. Number 6. Psychosocial impact. Living with HIV/AIDS can have profound psychosocial implications. The diagnosis can cause significant emotional distress, fear, anxiety, and uncertainty about the future. Stigma and discrimination associated with HIV/AIDS can also contribute to feelings of isolation, shame, and reluctance to seek medical care or disclose one's HIV status to others. Mental health support, counseling, and access to support groups are crucial in addressing these psychosocial challenges and promoting overall well-being. Number 7. Prevention. Prevention of HIV transmission is critical and includes a combination of strategies. Safe sex practices. Using condoms consistently and correctly during sexual activity can greatly reduce the risk of HIV transmission. HIV testing and early diagnosis. Regular HIV testing allows for early detection and timely initiation of treatment if necessary. Pre-exposure prophylaxis, or PrEP, is a medication regimen taken by HIV-negative individuals to reduce the risk of contracting HIV from sexual activity or injection drug use. Needle exchange programs. Providing access to sterile needles and syringes helps reduce the risk of HIV transmission among people who inject drugs. In summary, HIV/AIDS is a complex and chronic condition that affects the immune system, leaving individuals vulnerable to opportunistic infections and certain cancers. While there is no cure for HIV, effective treatment with antiretroviral therapy can control the virus, improve immune function, and allow people with HIV to live long and fulfilling lives. Early diagnosis, access to medical care, and supportive interventions are crucial in managing HIV/AIDS and reducing its impact on individuals and communities.